Health and Safety in a Fitness Environment, Part 1. This webinar is all about helping you guys complete your worksheet, Health and Safety in a Fitness Environment. You've got 13 questions in this worksheet and there's 37 marks available. You've got to get 30 marks in total to achieve a pass, but make sure you check the minimum pass mark for each question as well. Now, don't forget, there's always a guidance document in your study portal. So if you want to read the exact pages that are relevant to each question, then check out that document. I highly recommend it as it will really reinforce everything that I've gone through today during this webinar. So by the end of this session, you will understand health and safety in the workplace, understand hazards and risks in a fitness environment, understand normal and operating procedures in the workplace, understand how to maintain a safe and effective fitness environment, understand the cleaning requirements in a fitness environment, and understand safe working practices relating to the control of substances hazardous to health, which is the COSH regulations. So why is health and safety so important? Well, it's important in every workplace, but if you think about a gym environment, there's lots of potential hazards. The Health and Safety at Work Act 1974 comprises a variety of health and safety laws and regulations. It stipulates the duties of employers and employees, and it's implemented by the Health and Safety Executive and the local authorities. The Health and Safety Act poster must be clearly displayed in the workplace or an equivalent pocket-sized leaflet given to employees. So what are the responsibilities of the employers? Well, they need to make sure that regular risk assessments are carried out. They implement safety measures. They appoint people to manage the welfare of others. They devise emergency procedures, provide clear guidance and training for employees, and report injuries. They also need to have insurance, provide facilities and equipment for dealing with health and safety, display a health and safety policy statement, provide and maintain equipment, provide toilets and washrooms, and provide drinking water. Employees also have responsibilities. They need to make sure they follow procedures and training programs correctly, take care of their health and safety at work and that of others around them, and cooperate with their employer and report any concerns immediately. Now, as an employee, you have some rights as well. You have the right to an explanation of how risks should be controlled and who is responsible for managing the risk in a way that you can understand. Provision of health and safety training should be free of charge. Provision and adequate maintenance of any equipment and protective clothing should also be free of charge. You should have access to toilets and washing facilities and drinking water. You should have access to adequate first aid facilities. And there should be insurance that covers you in the event of any injury or illness sustained through work. Now, there are various regulatory requirements as part of the Health and Safety at Work Act. Here are just a few. RIDOR. RIDOR is reporting of injuries, diseases, and dangerous occurrences. This stipulates that employers must report injuries, diseases, and dangerous events. Manual handling operations regulations. These stipulate that employers must have procedures in place for lifting or moving objects. Personal protective equipment at work regulations, or PPE. This stipulates that employers must provide you with protective equipment and clothing. And control of substances hazardous to health, or COSH. This stipulates that employers must control exposure to hazardous substances to prevent ill health. Now, what happens if you fail to follow regulatory requirements? You can be fined. You can even go to prison. You could be disqualified from a professional membership, such as reps or SimSpa. You could be disqualified from Companies House as a registered director. Duty of care. Duty of care is the obligation to apply a reasonable level of care towards an individual to avoid injury to that individual or his or her property. A reasonable level of care is considered to be that you have, to the best of your knowledge and ability, taken all the necessary precautions to minimize risk. Hazards and risks. A hazard is anything that can cause harm, like a trailing wire. A risk is the likelihood of somebody being harmed and the severity, e.g., sprain or electrocution. This is the Health and Safety Executive scoring system for evaluating hazards and risks. What you do is you take a hazard, let's go with a trailing wire, and you score it based on how likely somebody is to hurt themselves. If we think it's very unlikely, we give it a 1. We then look at the severity and we think, well, if somebody was to trip over that wire, how severe would that be? So let's say we think they'll probably be off work for a few days. We give it a 3. We then take the first number, times it by the second number, 1 times 3 equals 3. And then on the third row, we can see that 3 is just on the cusp of tolerable to medium, which means we can just maintain the existing control measures. If it had a score of 11 to 25, then we know that that's dangerous and we need to change something. The existing control measures aren't good enough. Normal and operating procedures. These are written systems of work, the aim of which is to maintain the safety of all parties, staff and users. So we divide them up into our just regular day-to-day operations and then times of emergency. So the normal operating procedures apply to the working environment when everything is working normally. Emergency action plans refer to when things go wrong. So have a think about what should be included in a normal operating procedure. Well, there could be details of the actual facilities, so the size of the facility, the layout, the position of fire alarms, fire exits, etc. All the potential risks, how to deal with the public, so maybe rules and the way we communicate, all the staff duties and responsibilities, systems of work, operational systems, then more detailed work procedures such as how to open up or close a facility. First aid training and supplies, how to operate the alarm system or any emergency equipment, and then what goes on outside of the gym. What should be included in an emergency action plan? Well, this should be what to do in the event of the following, what to do during, and what to do after. If there was a bomb threat, an evacuation, a gas leak, a fire, life or death situations, or any other emergency specific to the environment. Now, one of the ways we can reduce the likelihood of an accident occurring is to walk the gym floor regularly. When we do that, we can check for the tidiness and the cleanliness. We can make sure that customers are performing exercises safely and with effective technique. We can make sure that customers are wearing appropriate clothing and footwear. We can also check for overcrowding in certain areas. Why is cleanliness and hygiene so important? To prevent the spread of harmful diseases and infections. Aesthetic appearance. Clean environments look more inviting. Staff prefer a safe, clean place of work. and to reduce the wear and tear. Regularly cleaning items helps them last longer. Here's some scary stats for you. Treadmill, 74 times more bacteria than a tap in a public toilet. Ugh. Free weights, 362 times more germs than a toilet seat. Exercise bike, 39 times more germs than a tray from a school canteen. This is a typical cleaning rota designed to ensure that the cleanliness of the gym is maintained. When a gym instructor is on shift, all they do is look at the list and they try and clean as many different things as they can, making sure they initial exactly what they've done. And then it's a really clear visual representation of what the gym instructor's done and what they haven't done. So what sort of cleaning equipment and PPE will a gym instructor be using? Well, mainly brushes, hoovers, spray bottles, cloths, sponges, blue roll, hand towels, mop and bucket, and bin bags. That's about it. Now, we always encourage gym instructors to wear rubber gloves when they're doing their cleaning. And if they're doing any deep cleaning, so when the gym is shut to the customers, if they're using anything that's a bit more harmful, then they'll wear eye protection and a face mask. So we mentioned COSH earlier, controlled substances hazardous to health. This is the law that requires employers to control substances that are hazardous to health. The steps advised are: find out which substances are harmful, how they can harm, consider how the workers may be exposed to the risk, complete a risk assessment for the use of these substances, and then implement any control measures to minimize risk. Now, if the existing control measures aren't adequate, there can be quite a few problems caused by hazardous substances, such as allergic reactions, chemical burns, inhalation injuries, poisoning, vomiting, fainting, and skin damage. Now, employers, if they want to prevent and minimize the risk of problems, will follow certain procedures. For example, they need to make sure that they carry out their COSH assessments. They need to have safe systems of work and control measures in place, to include provision of safe, secure storage, provision of appropriate personal protective equipment, COSH data sheets, and they need to monitor and evaluate control measures, train staff in safe systems of work and storage policies, have arrangements to deal with accidents and emergencies. And employees need to make sure they follow these systems of work. They don't use chemicals that they've not been trained to use. They store, use, and dispose of chemicals safely and securely in line with policies and COSH data sheets. Attend and engage with staff training. Wear their PPE. If in any doubt, check the COSH data sheets or the normal operating procedures, or check with their manager. And maintain hygiene standards at all times. Typical COSH assessment follows the following steps. Identify the substances that may be hazardous to health. Gather all the information on that substance. Evaluate the risks. Implement measures to control the risk. Record the findings, and then complete regular reviews. That's everything you need to complete your health and safety in a fitness environment worksheet. So don't forget, it's just 13 questions. There's 37 marks available in total. You only need to get 30 out of 37 to pass. But double check, because every question has a minimum pass mark. And lastly, make sure you check out the guidance document in your study portal, as it will tell you exactly what page numbers to read to make sure you answer all the questions correctly. But more importantly, reinforce your understanding of this subject.